Mental health care has become a major issue and concern here in the city over the past few years. People living with a mental illness often end up in an emergency room or behind bars during a mental health crisis. A new alternative is about to open on the Lower East Side. It's described as the first ever peer-led respite center, a community-based response model known as Soteria. Joining us now are Irfan Hasan. He's the Vice President of Programs and Grants at the New York Community Trust, the group that is actually funding the center. Also with us, Lauren DeSelt. She's a Program Director at Community Access, the group launching this new center. Great to have both of you with us this morning. I'm going to start with you, Laura. Just to talk to us a little bit about this is the first of its kind here in the city. You've seen some progress with this internationally. So tell us what it's really, how this is all going to come together here in the city.
Sure. The Soteria model actually started in the early 70s in this country in a National Institute of Health grant in California, but it was started by Lauren Mosher, but it didn't really take off in this country. It has been successful in other parts of the world, and as I had mentioned earlier, it's really a person-centered model. It is not, medication can be used, but it's really not the first means of getting to serving the person. So we're really looking at the person first and looking past diagnoses.
So with peer-led, someone who has gone through a mental health situation before, they work alongside clinical staff to deliver the services.
Yes.
Tell me about that, and why do you think that is a model that needs to be implemented here?
Sure, it's peer staff with persons with their own lived experience with a mental health concern. And the difference is that there's a real capacity to listen. It's sort of a genuine chord of empathy, which we think and we know builds a collaborative relationship at the start of care, for which the person can be heard and can draw with that staff person a plan to move forward. So it really allows for the opportunities to create space to determine how to make plans to move forward.
And Irfan, again, it's your group that is funding this. The New York Community Trust funds a lot of different programs, gets involved with a lot of different solutions, trying to find solutions here in the city to different issues. Why this? Why did your group decide that they needed to be a part of this?
So for a couple of reasons. One is mental health is just an important area in the city, and we've had a long history of supporting programs that focus on mental health. Second, last year was our 100th anniversary. We turned 100, and we reached out to New Yorkers and asked them what are the important issues that they see that are important to the city, and mental health was one of them. And I guess three reasons. The last is we are fortunate to have legacies from people who have left the trust money for various issues. And one of the areas where people have left some money is in mental health. And this program actually uses some funds that are focused on crisis intervention and suicide prevention, left to us back in the 40s, even before the Soteria model was invented. It's kind of nifty that that's coming together now.
And I should mention, not only is it not used here, it's really not used across the country, correct? In the U.S., it's kind of new all over.
No, this would be, to my knowledge, this is the first.
And so what do you think will happen after it's set to open later this year in the fall, Lower East Side? Do you think once it's open, people will see what it's all about, and perhaps they might sort of take a second look and go, maybe this is something that needs to be more widespread in the city?
We hope so and think so. We are going to have a research arm to this as well to track it and track outcomes 3 years out, so to make it easier to replicate this model and learn from what we're doing.
And you think the biggest impact will be what from this?
That people will know that there is a place in their community, a solution in their community where they can find greater get closer to their own, to a better quality of life and relief for loved ones as well. Just more opportunity to find recovery for psychosis-related crises in the world that we live in.
And Irfan, what are you hoping to see out of this, especially since you're now so involved?
I think first and foremost, New Yorkers who are in a crisis have a place to go. They're our neighbors, they're our family, they're our friends, they are us. and we need places for people to go to feel safe. And then second, I think it is important to remember that when one is in a mental health crisis, there are many ways to approach it, and this is one more way.
One more way to an approach here in this city that, again, is so complicated and so now widespread across the city that we've seen over the past few years. I really appreciate both of your time here this morning. Community Access, again, is the group that is going to be launching this Soteria model. We'll put up your information on the website so people can learn more, communityaccess.org. Thank you both again for being with us.
Thank you.
Thank you.